Hello and good evening to all of you watching the Daily Nurse Practitioner. Today I want to talk briefly about different types of asthma, mostly categorized by their triggers. It is the time of year where some certain triggers are definitely more active, more likely you're going to see an increased incidence of asthma. And you need to be able to work with the patient and their family, especially if it's in the case of a child, on identifying what's their triggers for their asthma. Because the more we can control the triggers, the less likely the patient is going to have to be using albuterol inhalers, or if you're looking at the GINA 2020 guidelines, using an ICS and LABA for your emergency inhaler. So asthma affects about 9.4% of children and 7.7% of adults, with children definitely being a large burden of that. It's very common for there to be a significant burden on emergency departments and urgent care centers for asthma, acute exacerbations of asthma because of a child or an adult being exposed to a trigger, running out of inhaler, not having it with them, thought they outgrew it, but it's back with a vengeance, never truly getting diagnosed or managed, and just kind of keeping on coming back for acute bronchitis or asthma exacerbations, but never really getting treated, identifying the triggers, or finding an underlying cause. So let's talk about some of the different causes. A big one, the most common type is allergic asthma. This affects about 60% of people who have asthma. Around 8 in 10 people who have allergic asthma will also have eczema, allergies, or a food allergy. And this is very common because those are all driven by histamine reactions. So it's not surprising that if you have one, you would have the other versions as well. So most of your patients will have co-diagnoses. Certain allergens are common in the environment and things that we would consider as high yield for causing an allergic asthma reaction. Pollen is number one. And so depending on where you are, if there's an excessive amount of pollen, you'll begin to see an uptick in patients who are coming in. Pollen, pet dander. So patients who have pets or who maybe go to a friend's house and there's a pet there can trigger their asthma. Mold spores are a big one, and it's definitely a common problem in moist environments, places that have a lot of rain, places that older homes that are not maybe as well sealed, homes that have any kind of leak. And it can happen anywhere. A leak that happens inside of a home can grow mold, and then you are, it's in the house, they're having a lot of breathing problems. And then foods, some foods can cause an allergic asthma reaction. This would be milk, eggs, certain nuts. Dust mites, cockroaches, and cockroach feces are another very common one. When people get their allergen testing done, there's a bunch of different ways to do allergy testing. Some places will do skin pricks, some do blood samples, but cockroach and cockroach feces, and that can happen anywhere. Irritants, so air irritants is definitely a big one. And this one's hard on people because they can't control, if someone's wearing perfume, I mean, that's an innocent thing, but it can cause someone else to have an allergic reaction, which is why healthcare providers really don't wear heavy scents or even lighter scents. So tobacco smoke, automobile, chemical fumes. So think about their work environment. Are they having problems breathing at work? And then again, other innocent run-ins with, irritating things in the air. Heavily fragrance products, again, such as perfumes. I definitely don't recommend you wearing a scent as a provider because that is going to bother a good percentage of your patients. It is important for people with allergic asthma to seek treatment, of course, to identify those triggers. How do we help them? It's a lot about environment control when we're looking at asthma. So we're thinking about vacuuming, dusting, really simple things, HEPA filters, having a designated area of the house for pets, no shoes in the house, don't wear socks in the house. That way you're not taking the dander from one room to another. Avoiding the food triggers is an easy enough one if they've been identified, and using different types of cleaners, or maybe not having anybody in the house, like the asthma kiddo in the house while you're cleaning, to avoid having those triggers. So just to think of different things. There are so many ways to clean a house without using all these heavily fragranced chemicals. Rubbing alcohol, hydrogen peroxide, all of these things diluted in water. There's different recipes online. So if you're having someone who feels like, I can't help my kid, they're reacting to everything, show them that there are ways without spending a lot of money to create their own cleaning chemicals, to remove instead of buy more things to help with the problem. So if a child has a lot of a dust allergen, removing a lot of things out of their room. So like taking down the toys. And I mean, it can be difficult because some of the recommendations are like take down posters, curtains, dust rails, the dust ruffle around the bed, rugs. I mean, really, really, if the kid's having a lot of trouble and we're using a lot of inhalers, really, really sterile environment can be helpful. Maybe you do, oh, I'm sure the painting would be an irritant too for a couple of weeks, but maybe a bright color paint in the room, something like that to help them still feel like there's personality in the room when you're having to remove everything that's in there. Freezing the animals, like they got stuffed animals, you freeze them. Put their toys in boxes, put away in the closet, let them pull out and play. So just that letting things sit and gather dust. When their clothes come out for the next season, sometimes you might have to run them through the washer and dryer because they've been sitting and they're dusty and they're going to be itchy and asthmatic. So what kind of other asthmas do we have? We have a non-allergic. So this is a less common type, about 10 to 33%. This one appears more often in adulthood and affects more females than males. These kinds of triggers are, if there's a genetic cause for this one, it can be some environmental factors, but things that can cause it: cold, humidity, stress, exercise, pollution, irritants, and respiratory infections. So if they're getting a cold or bronchitis, they also end up getting an exacerbation of their asthma. Other things are seasonal asthma. So again, these are people that have asthma only during certain times of the year. People will talk about like hay fever season. This is when pollen levels are very high. When weather changes, very cold or very hot, thunderstorms, sudden changes in temperature. So one day it's warm, one day it's cool and humid. Pollution is always air pollution is worse on cold days. During the winter month, there are more colds and flu viruses around. So you'll find people who only have problems during certain seasons of the year. And again, spring is a big trigger because there's a bunch of pollens and things like that around there. So you can see how we're falling kind of into more than one type here. The allergic asthma can have a cyclical thing to it if it's based on the outdoors. So they would have an allergic seasonal asthma. Some people have an allergic asthma that includes things that are also in the indoors. So we're not seeing it have a seasonal thing. It's all the time because they're allergic to the dust and to the cockroach feces and all those other indoor irritants, the pet dander. So they're not having a cycle, but if their allergic asthma is really only triggered by things like pollen, then you're looking at a seasonal asthma. Keep those windows shut, windows and doors closed. One of the tips is to wear a scarf or in these days a cloth mask when it's cold outside because it actually warms up air as it's passing through. Occupational asthma, so patients may find that they only have their asthma when they are working or that they notice that they feel they can breathe more when they are off of work. About up to 15% of cases can be related to a job-related exposure such as paint chemicals, aerosols, insecticides, and other harmful substances. Some people may have an immediate response, but up to 24 hours after an exposure can have an allergic asthma response. People with occupational asthma need to, they need to really find a way to wear something that's going to alleviate their exposure. Sometimes it's going to be different levels of masking for an occupational hazard, or if it is very severe, considering a change in work or helping them as a medical provider, helping them in disability or things like that, if it's something that's not going to be able to be resolved. Exercise-induced asthma. So this exercise-induced asthma can happen during or immediately, even up to 5 to 20 minutes after they've stopped exercising. This one's very, very common. About 90% of people with asthma also have an exercise-induced asthma. So they start running, they're doing PE, anything like that. They are dealing with their wheezing, their shortness of breath, and their chest pain. So the following factors may worsen the symptoms of an exercise-induced asthma. So we think, okay, PE, sports, playing outside, etc. What other confounding factors are going to increase that severity of the reaction? Chlorine pools, polluted air. So thinking of like if they're running in the spring, it's like double whammy. The other thing is cold, dry air. So if people are trying to play hockey or ice skating or running while it is very, very cold, cold, dry air is much more likely to trigger an exercise-induced asthma reaction. But also very, very warm and humid air. So the body likes to have this nice, happy little stasis. Well, if you push it too far one way or too far the other, patients can have an asthma reaction. And like I've said, it's about identifying what the patient's triggers are because everybody's triggers are different. Asthma medications, again, need to be utilized when they are exercising. They need to take the inhaler before they exercise in order to prevent the exacerbation from occurring. Severe asthma, so severe or brittle asthma, only about 4% of patients are considered very severe. These patients may have to take steroids long-term by mouth. Sometimes they are in the hospital setting. But again, this is not most of our patients. Most of our patients are, improved with the standard medications. But those are some of the different triggers. All the different things that create that inflammatory response, the body saying there's something here that shouldn't be here, and kind of having this incorrect response to things. So could think about the most common triggers as being allergy and exercise. Those are the biggest categories. Most of your patients with an allergic asthma will also have allergic rhinitis, atopic dermatitis, or food allergy. So make sure you're working them up for those additional things as well. Send them to an asthma and allergy clinic if you have one in your area. If they need to get tested for specific allergens via skin prick or laboratory testing. And then with exercise-induced asthma, just making sure that they keep their inhaler on hand. When you're doing sports physicals, that if you identify that they say that they're short of breath when they're running, that you work them up for mild asthma or prescribe an inhaler to see if it relieves the symptoms, and make sure they have that on hand with a couple of refills, and to teach them to take it before their activity begins so that they can have that relief and never even get into the exacerbation. All right, I hope this helps you when you're working with your patients with asthma.